Have you heard of Reiki? It's a Japanese form of therapy that's said to reduce stress and anxiety through gentle touch.
It's transferred through the practitioner's palms to the client, and Suncoast Hospice is offering this to patients. Reiki masters Judy Bortnis and Ann Glover are here with us this morning, so welcome to you both.
Thank you so much, Janelle.
Yeah, I feel like we've been learning so much about this. Very interesting. So let's start by just explaining to us what it is.
What Reiki is?
Yes.
I would love to. Thanks, Janelle, and hey, Jabba. So great to be here. Reiki is a very gentle relaxation technique that can reduce pain, it can lessen anxiety, and it can actually help you sleep better at night. It has the potential to reduce, as I said, reduce pain, but also to increase a sense of well-being and comfort. And that's why we choose to offer it to our patients.
And how long has this Japanese form of therapy been around, and when did you incorporate it into your, you said the hospice?
Reiki has a long history. It's actually been around for 100 years.
Wow.
It was created in 1922, and here we are in 2022. But at Suncoast Hospice, we've had an integrative medicine and palliative arts program since the year 2000. And 3 years later, we added Reiki to our menu of palliative arts that we can offer to our patients. So almost 20 years.
Wow.
Okay. And so, Ann, you're a volunteer there at hospice. What have you noticed when you've seen the patients get this Reiki treatment? What do you notice?
I notice a sense of calm that comes over them. I feel like they are getting what they need at that moment, and sometimes they fall asleep, and that's okay. That's really okay.
Okay.
Okay, now you're going to show us exactly how it looks. Do you mind?
I would.
I would love to receive Reiki today.
Well, I asked
And I
earlier,
would love to
said,
provide
"Do you guys like to
Reiki."
receive Reiki as well as yes, it's great to receive. Yes.
Absolutely.
Okay, I'm so fascinated to see
Okay.
how it looks. Do you actually touch or no?
There's a couple rules about providing Reiki. The
okay.
first is we always ask permission.
Yeah.
So, Ann, would you like to receive Reiki today?
Yes,
Okay.
I would like that.
And then the second question is, do you prefer touch or non-touch?
Okay.
I prefer touch.
All righty. We always make sure that we're doing exactly what the patient prefers.
Okay.
Now, most Reiki treatments begin just like this, the crown of the head.
Okay.
And we might leave our hands there for as long as 3 to 5 minutes in that position. And then we might start to move down. A Reiki session can last for our patients maybe 15, 30 minutes.
Wow.
Okay.
But that's because maybe they can only tolerate so much being hospice patients.
Right.
Whereas if I were providing Reiki to Ann and she was not a hospice patient, it might actually last for a full hour.
Okay.
So I might stay here a very long time before I change positions and move on down.
Okay. What kind of training is involved to become a Reiki master?
Yeah. So there's 3 levels of Reiki. There's Reiki level 1, and that's the very first level that we provide to our volunteers and our staff members. And that's an 8-hour training. And then after being out in the field working with our patients for about 2 to 3 months, they can come back and take Reiki level 2, which is another 8 hours. And then after a few years of really providing Reiki and understanding how it works, then they can go on to become a Reiki master, which means that they can then become a Reiki teacher. Because we need additional teachers to train all of the volunteers and the staff members that serve our patients.
Wow.
Yeah.
So outside of hospice care, are there other places here that offer Reiki as a treatment?
Yes, there are.
There are.
There are. The difference might be, and I'm going to come around and continue this treatment.
How do you feel?
Very relaxed.
Okay, I can tell. I'm like, can I be next?
It doesn't
Just move
take
on down the
long,
line.
but I want to show you some different options for
Okay.
providing Reiki. You know, our patients might be in a wheelchair.
Right.
They might actually be in a hospital bed. They're not on a massage table, which is what you might see out in the community.
Right, sure.
So let's say that Ann was actually in her wheelchair. Well, I might just sit next to her and do this. This is a wonderful treatment going from joint to joint for someone who might be elderly, suffering from arthritis, and so I might leave my hands here for a good 5 minutes, and then maybe I would move down to this joint
Yeah.
and this joint.
Well, we've run out of time, but thank you so much for introducing us to Reiki. I never heard of it. Have you heard of it?
I have heard of it. I wasn't sure exactly what it was or what it did, but I have heard of it.
I haven't even heard of it, so thank you for introducing it to me, and we appreciate you guys
It's our
joining us.
absolute pleasure. Thank you so much.
Pleasure.
If you would like to learn more, you can head to suncoasthospice.org.